Did you know that one of the most common causes of type 2 diabetes is toxicities? Toxins can come in multiple forms: mold toxicities, heavy metals, even environmental toxins. So today I'm going to be sharing with you a actual study or test that we did on a patient that shows us how these toxins actually drive their diabetic condition. Now, before we jump into that, I want to just preface one thing, because sometimes you may be watching my video for the first time. But as a reminder, diabetes is not a blood sugar issue. The entire medical industry wants you to think that it's a blood sugar issue because they can focus on driving sugars to go down with blood sugar medication. The reality is diabetes is a cellular disease. Our cells, we have trillions of them, have these little doors that open and close to allow the sugars to enter from your bloodstream into your cells. That's normal function. But as a type 2 diabetic, those doors are closed. The more doors that are closed in your cells, the less sugars can get inside your cells, which then starts to drive them back into your bloodstream, causing elevated sugars. So if we only focus on trying to lower the sugars, will that ever fix our cells? No. And this is why we have to identify the specific mechanisms that are driving the cellular damage, or what I refer to as the cellular disease. Well, toxins is one of the most common things that we notice that are contributing to cellular disease and the progression of diabetes. So as we can see here, we tested this individual, and I'll bring the test up here. And this individual, we evaluated them through a toxin test. This test has multiple different toxins that we evaluated for. Today, we're going to go over mold, because mold is a very important analysis to identify because it's very damaging to the body, specifically your cells. The good news is a very simple test. It's a urine test that can be done very simple. You collect your first urine, and then we can get the results back from the lab. But when we look at mold tests here, this is what the scientific word for mold means, by the way, is mycotoxins. If we scroll down here, we can see this individual, they had multiple different types of mold toxins that were showing up. So if we look here, we can see we have a couple of species here. These are called aflatoxin species, or types of mold species, if you will. Now, mold can be acquired or exposed to an individual through multiple different ways. It could be through water-damaged buildings. It could be through food sources. Now, these exposures could be recent exposures, or they could be 20, 30, 40 plus years ago. Because remember, these toxins don't have to be a recent exposure. They can be exposures from decades ago that are still impacting the body. Now, here's what you need to know. Because oftentimes when we get exposed to mold, if the body has the inability to get rid of it, it's going to stay in the body. And we can see here, because when you look at this test, anything you see in the yellow or red is considered toxic to the body. It's a toxin inside your body. So this indicates that this specific toxin is stuck in their body. And when toxins are stuck in your body, they'll migrate over to your cells, start closing down those cellular doors, and they'll progress into conditions like diabetes. So let's take a look at this, because we can see these are direct links to their diabetic condition, but they'll also impact other areas of the body as well, which are also involved in blood sugar regulation. For example, when we look at aflatoxin species here, they are hepatotoxic. Hepato means liver, by the way. So it's a toxin to your liver. Well, the liver's, one of its primary jobs is to regulate blood sugar. So not only does this toxin impact the cells directly, but it's impacting one of the most important organs for blood sugar regulation. It's no wonder this person has diabetes and why it's progressing. We can see there are multiple others here. Look at all these toxins. Look at these levels here. This is not uncommon to see, by the way, with individuals who are dealing with type 2 diabetes. So let's go through some of this stuff. CHA is highly toxigenic, so toxigenic it can cause cerebral disease. Well, that's another term for type 3 diabetes, which is Alzheimer's and dementia, a complication of diabetes as well. Individuals who have type 2 diabetes, they're already at risk of developing these types of things. Citrulline, the predominant organ of toxicity, is the kidney. So not only is the kidney a common complication of diabetes, but it's involved in blood sugar regulation. If your kidneys are being destroyed and killed by these toxins, how are they going to function properly? They will not. Not only will it perpetuate the disease process, but eventually causing more kidney disease, leading to dialysis. Fumonisin species, look at this, cell cycle necrosis. What does that mean? That means cell death, guys. It's destroying and killing your cells. These are very, very damaging, very problematic. And again, many of the diabetics that we see have these problems that are driving their issues. Gliotoxin is the disruption of the blood-brain barrier. It also impacts the immune system. So for those of you who are dealing with autoimmune diseases and diabetes, this is a common toxin we see because it drives the immune system to attack your own body. But more importantly, disrupts the blood-brain barrier, right? Type 3 diabetes. Ochratoxin A is another kidney toxin, but not only that, it actually causes intestinal barrier disruption. So what does that mean? It means leaky gut. So many of you have heard the term leaky gut, but don't really know what leaky gut is. Essentially, leaky gut is where toxins like ochratoxin A get stuck in your body, they migrate over to your gut, and they start disrupting the ability for the gut to do its job, which is what? Absorption, digestion. Not only does it lead to nutrient deficiencies, but it can start leading to GI dysfunctions. It can lead to colitis, inflammatory bowel disease, dysbiosis. So there's multiple problems that these underlying problems are creating, and unfortunately for most people, they're just addressing the symptoms and not the cause. Patulin, again, leads to GI issues, leaky gut, but it can also lead to what? Neuropathies. Many individuals that are dealing with diabetes have neuropathy. You may be one of them. These toxins are oftentimes a major culprit to those types of conditions. Look at this, STC, hepatic, remember that means liver, necrosis. This is liver death. The liver is dying and being destroyed, as well as a nephrotoxin, which means what? Nephrologist is a kidney doctor. So this is your kidneys being broken down. These, again, are not uncommon to be seen, and we see these all the time on a lot of our patients we work with. Here are three more. Reridin L2, it directly impacts the cell membrane, which is what? Closing the cellular doors, progressing your diabetes. Satrotoxin G, this is black mold. Look at this. The most cell toxic mold species currently known. Very damaging, very problematic. Many individuals have this. And Veracurin J inhibits the protein synthesis as well as DNA and RNA damage in the human cells. So look at this scenario here. We just looked at multiple types of mold species, right? If we go back to the top up here, all of these mold species, as a reminder, cause cellular damage. So number one, they are a link directly to the cellular disease and the progression of the diabetic condition. But number two, they also impact other areas of the body, like the brain, like the heart, like the kidneys, the liver, your nerves, many areas that some of you are experiencing symptomatically, and you're just being given pharmaceutical drugs, even though these things have not been addressed. But why is that? Why are you not being evaluated for these types of toxicities that are so commonly involved in the inability to regulate blood sugar, but more importantly, involved in the progression of diabetes? Because there's no pharmaceutical drugs to address them. Remember the medical model. No medications, surgery, or injections, they can't help you. So this is so important that we really understand that just by doing the average testing, looking at your blood sugar, checking your A1C, checking your kidney, check for whatever else they're checking for on your blood test, that is not evaluating you for cause. That is evaluating you to identify, is the current medication working? Do you need additional dosages, or do you need an alternative medication? That's called managed care. They're managing your diabetes with pharmaceutical drugs. While these problems you see here continue to get worse over time, and you get worse over time. So it's no wonder why we see so many people progressing with diabetes, because all of the focus is on the symptom, i.e. trying to lower sugars, which never will get you anywhere, while the true underlying issue, the cellular disease, and the underlying causes of that cellular disease, like toxins, are never being evaluated. They're never being addressed. And so you get sicker with time. And the worse it becomes, the worse you become. But here's the thing. We can go over all this testing. We can talk about all the details about what's going on, but it has nothing to do with you specifically. All right, we'll see you soon. Take care.